My name is Aniekan Akiki. I work with Save the Children International. I am the WASH coordinator covering Ogoja, Nigeria, the refugee program in the southern part of the country, which is receiving the influx of refugees in Nigeria currently. As we speak now, we are still experiencing inflow of refugees due to the COVID and also the uprising cases of conflict in Cameroon. So the main reason of refugees coming are mainly because of the living conditions in Cameroon because of the war is getting unbearable, and also they are living in remote and inaccessible areas, which is near the border town of Cameroon. Now the refugees influx continue to increase daily, and we are targeting over 45,000 refugees. We are also covering the areas of WASH, water, sanitation, and hygiene, which is mainly taking care of refugees' basic needs of their sanitation needs. Now, we've been able to cover a lot in the settlements, and also moving critically because of the COVID-19 period, we also expand our coverage to both the host community, the motor parks, and the support places, which we also carry out joint IECs and joint unitization with our donors and partners, which everyone also knows what to do to stay alive in times like this. Now, however, we also continue to expand our area of coverage with the critical IPC and the WASH activities we are carrying out in our various locations. We also ensure that we are carrying out the disease transmission route. We are breaking that route where we improve on water supply, environmental cleaning, and hand washing. The core IPC measures we are carrying out in water is the water remote monitoring system, which we have installed and which encourage the remote monitoring of water supply in the settlement, giving us the daily records to keep track of how many volume water has been delivered per day. Also, this also eliminates the risk of the tank operators or the pump operators climbing up the up ladder to check the water level, whether it's empty or full, before pumping for the day. This system automatically restarts itself once it gets to zero level. Also, we discovered that we had a lot of queuing time from families or from households at various water fetching points. We decided to improvise rainwater harvesters, which will now reduce the queuing time due to the high density of rainfall in this area. Now, this rainfall supplied in this area were able to be harvested and stored in the 5,000 liter capacity tanks, where the families are now using it at various communities. To take off oral fecal contamination, we proceeded with decommissioning and disinfecting old latrines, and also providing sanitation tools to various communities to use for their various decommissioning. Save the Children champion providing the technical assistance in this decommissioning process. The communities are provided with digging tools, diggers, brooms, disinfectants, rakes, and etc. Also, this particular sanitation activity are also championed weekly in all settlements. Settlement also covers the market areas, which is commonly used by everyone and actually not owned by anyone. So hence, the cleaning process is done weekly with the sanitation tools provided, and all the waste generated are disposed in the waste disposal pit created by Save the Children. Also, PPEs and masks are also encouraged to be used by the people during this cleaning with hand gloves. To avoid littering of the marketplace, Save the Children encourage this cleaning and also provide these tools to be properly done with using wheelbarrows to convey them from point A to point B. Now, definitely, we took into consideration the architecture or the construction design of the waste pit. And also, this pit is so unique in the way that it's not just a pit of 3 meter depth, straight line, triangle, cube form. This pit has steps in a way that it reduces the risk of injury in case anyone accidentally fall into the pit. The pits are being excavated in layers of staircases made from the underlying rock soil formation. So also allow anyone to just use those steps and come out of the pit in case of a person falls in. In terms of falling in those pits, also consider protecting those pits and barricading them from injuries. Also showing that it is only meant for disposing of pits. So this avoid, we also use this awareness to create that children do not pick up these PPEs and children do not play around the pit. Also, to avoid children picking up the PPEs and reusing them, Save the Children is also recommending with the Ministry of Health burning those PPEs if possible to discourage children from using them, and also encouraging use of reusable masks, which is safer. Save the Children currently is taking IPC measures also on construction. All our contractors have been given COVID-19 documentation to sign before implementing contracts. Then for a direct implementation, Save the Children is actually ensuring that we have small numbers of people working at a particular site. Saying, for example, we try to limit the number of people working in a particular site to 2 or 3, at a particular train construction site to 2 or 3, and also encourage them using their own personal tools, not sharing tools from between themselves. So Save the Children also provide these working tools where some of them may be damaged. Also, the construction workers, which also own some of these tools, are encouraged to use the tools themselves for their various construction. We don't encourage sharing of these tools, and then we encourage hand washing periodically. Basically, they work with water, so they wash their hands regularly before commencing or in between breaks. Also, once we notice or anyone complains is feeling feverish or something, we can allow that particular worker to take some rest to recuperate to limit the risk of the virus being spread.